Why wireless health concerns rarely appear in U.S. state legislation. Concerns about the long term health effects of wireless radiation surface regularly in public comment periods, town halls, and local zoning disputes. Yet at the state legislative level, those concerns are notably absent from statutory language. Instead, bills addressing wireless infrastructure overwhelmingly focus on deployment speed, zoning uniformity, and limits on local discretion. This gap is not accidental. It reflects legal constraints, regulatory precedent, and political risk calculations that shape how states engage with telecommunications policy. Federal preemption narrows the legislative field. State lawmakers operate within a tightly constrained legal framework. The Telecommunications Act of 1996 reserves authority over radio frequency, RF, emissions, and human exposure standards to the federal government, specifically the Federal Communications Commission, FCC. As long as wireless facilities comply with FCC exposure limits, states and localities are prohibited from denying permits or imposing conditions based on health or environmental concerns. This preemption effectively removes public health considerations from the legislative toolkit. Even when constituents raise questions about cancer risk, neurological effects, or cumulative exposure from dense small cell deployments, lawmakers lack a legally defensible pathway to address those concerns in statute. State bills prioritize deployment certainty, not risk evaluation. Recent state legislation illustrates how thoroughly health issues are sidelined. A 2026 Virginia bill, pre-filed in January, focuses almost exclusively on restricting how local governments review and approve wireless infrastructure applications. The bill bars localities from questioning an applicant's technology choices, service need, or coverage objectives, and explicitly prevents denial based on wireless facility type or capacity expansion. The legislation also limits requirements for propagation maps, traffic studies, and financial surety, while narrowing setbacks, aesthetic conditions, and co-location mandates. Nowhere does it reference RF exposure, health monitoring, or long-term environmental assessment. This omission is not unique to Virginia. It reflects a national pattern in which state laws function primarily as deployment accelerators. Health policy sits outside telecom committees. Another structural reason wireless health concerns rarely surface is committee jurisdiction. Telecommunications bills are typically heard in utilities, commerce, or technology committees, not health or environmental committees. As a result, legislative debates center on broadband access, economic competitiveness, and infrastructure modernization rather than epidemiology or public health research. Introducing health considerations would require cross-committee coordination, new expert testimony, and potentially conflicting statutory mandates. For many lawmakers, the political and procedural cost outweighs the perceived benefit, especially given federal preemption, scientific uncertainty, and political risk. The science surrounding long-term, low-level RF exposure remains contested. While some studies suggest potential biological effects, federal agencies continue to maintain that existing exposure limits are protective. In this environment, state lawmakers face a high evidentiary bar. Advancing legislation that implies health risk could invite legal challenges from wireless providers and accusations of undermining federally established standards. From a political standpoint, the issue is asymmetric. Wireless deployment is tied to economic development, emergency response capabilities, and digital equity. Raising health concerns without clear regulatory authority risks being framed as anti-infrastructure or anti-innovation, a position few state leaders are willing to adopt. Local governments bear the public pressure without the authority. Ironically, the public pressure around wireless health impacts often lands at the local level, where residents see towers installed near homes, schools, and workplaces. Yet state legislation increasingly strips local governments of discretion, standardizing approval processes and limiting grounds for denial. This dynamic creates a governance gap. Public concern exists, but no level of government is both empowered and willing to address it directly. States defer to federal authority, localities are constrained by state law, and federal standards remain largely unchanged. What this means for sustainability and risk governance. For sustainability and risk leaders, the absence of wireless health considerations in state policy highlights a broader governance challenge. Emerging infrastructure risks, particularly those tied to cumulative exposure, long term uncertainty, and public trust, often fall between regulatory silos. When authority is centralized but impact is local, policy gaps persist. Until federal exposure standards are revisited or states are granted clearer authority, wireless health concerns are likely to remain outside formal legislative language, addressed informally through community engagement, litigation, or corporate siting strategies rather than statute. You've been listening to Sustainability Soundbites by Environment and Energy Leader. For partnership opportunities, please reach out to our team.